This is part 3 for non-clinical legal and ethical principles, roles and leaderships for nurse practitioners. In this video, I will go over legal and ethical principles, and I will go over some practice scenario questions and their rationales with it. So let's get started. The first topic that I would like to cover in legal and ethical principles is justice. Justice means doing what is fair. In other words, you're treating other people equally and fairly. What's an example of this? An example of justice would be ensuring, let's say, a patient who has history of alcoholism, that her alcoholism does not bias us as an NP against her, while ensuring that she has the capacity to fully understand her decision and making her aware that she will be treated fairly. Beneficence is doing good. It's promoting well-being and doing good. It acts in a way that benefits the patients. It's the centerpiece of caring. And it's closely related to non-maleficence, but remember, with beneficence, it's what is good. Now, non-maleficence is doing no harm. So do not cause harm, and preventing harm or removing harm. Non-maleficence, remember, doing no harm, least harmful to reach beneficial outcome for a client or a patient. And so it's more abiding than beneficence because you're going to go beyond just trying to do good to that patient. You're trying to prevent them any harm. Okay, so let me give you an example of beneficence. Beneficence would be providing a broad spectrum antibiotic therapy to a child, let's say with meningitis. This would be an example of beneficence. Beneficence is promoting the well being of the patient, doing good, okay? An example of non-maleficence would be taking that broad spectrum antibiotic therapy and giving another one once you get the test results from the meningitis, right? So it would be focused antibiotic therapy given to that patient. Another example of non-maleficence would be, let's say, if you have an incompetent or chemically impaired nurse practitioner or a nurse, let's just say, taking care of patients, and you have another nurse reporting that abuse just to protect that patient. So it's doing no harm. It's making sure that the patient is safe and avoiding risk, minimizing it, right? Okay, so now let's talk about fidelity. Fidelity is the duty to do good to others and to maintain a balance between benefits and harms. So, in other words, it's being faithful to commitments made to self and others. So, you're going to be making sure that all the statements at this point and interactions that you have with the client are truthful and accurate. So, an example would be making sure that whenever you say such promises like, I'll be right back with your medication, give me 2 seconds, or I'll be back with your pain medication. And nurses should take these promises seriously because the patient on the other side is expecting, okay, you know what, 2 minutes, she said 2 minutes, I'm going to wait 2 minutes for her. And they take it literally. So you want to make sure that whenever you make a commitment to a patient or to yourself, you are following through. Autonomy. Autonomy is right to self determination. Think of freedom. So we know that when we treat each individual, they're seen as autonomous subjects. And these individuals have the right to make treatment decisions. They do also need to have capacity to make decisions. So let's say, for an example, you have a patient that's going into a surgery. The consent that we give to these patients, make sure that they have a capacity to make that decision. Now, also know that whatever decision that they do have, we as nurses or nurse practitioners always have to respect the patient's rights to make that decision, even if we don't agree with it. So that is in the client's best interest. They have the right to self determination. That is autonomy, when you give the power in their hands and they make that decision for themselves. Veracity, simple as being truthfulness, telling the truth. So, for example, would be telling the dying person he is dying or not, or lying to the sick people when a lie relieves anxiety or fear in them. So, that would be an example of veracity. Just being truthful. Do you tell the truth and be honest, or do you hide and lie to them. Another example would be, let's say you put a wrong ointment on a patient, and do you go back to the patient and tell them, hey, listen, I think I put the wrong ointment. I'm so sorry about that. Are you being truthful? Are you being honest? Are you telling the truth to the patient? And last but not least, respect. It's treating everyone with equal respect. So, an example of this would be knocking on the door before you enter a patient's room. It's introducing yourself, addressing that patient by their preferred name. I hope I haven't lost you yet, and I hope you're still here with me. And if you're ready, let's do some practice questions. I'll go over 7 questions with their rationales here. Question number 1. A PMHNP best applies the ethical principle of autonomy by A. Exploring alternative solutions with a patient who then makes a choice. B. Suggesting that 2 patients who are fighting be restricted to the unit. C. Intervening when self mutilating patient attempts to harm self. D. Staying with the patient, demonstrating a high level of anxiety. And if you're ready, the correct answer is A. Exploring alternative solutions with a patient who then makes a choice. Remember, autonomy is right to self determination. So it's giving and allowing that patient to make their own decision. And by exploring alternatives with the patient, you're allowing that patient to make a better informed consent, autonomous decision. And all the other choices, answer choices, are either demonstrating beneficence, it's demonstrating fidelity, or justice. Okay, let's do question number 2. Question number 2 says, in a team meeting, the PMHNP says, I'm concerned about whether we are behaving ethically by using restraint to prevent 1 patient from self mutilation, while the care plan for another self mutilating patient requires 1-to-1 supervision. Which ethical principle most clearly applies to this situation? A. Beneficence. B. Autonomy. C. Fidelity. D. Justice. And if you're ready, the correct answer is D. Justice. The nurse practitioner here is concerned about justice, and that is fair distribution of care, right? This includes the treatment with the least restrictive method for both of these patients. Now, we know beneficence means promoting the good of others, and autonomy is the right to make one's own decision. And lastly, fidelity is the observance of loyalty and commitment to the patient. Let's take a look at question number 3. A patient in alcohol rehabilitation reveals to the PMHNP, I feel terrible guilt for sexually abusing my 6-year-old before I was admitted. Select the PMHNP's most important action. A. Anonymously report the abuse by phone to the local child protection agency. B. Reply, I'm glad you feel comfortable talking to me about it. C. File a written report with the agency's ethics committee. D. Respect NP patient relationship confidentiality. And if you're ready, the correct answer is A. Anonymously report the abuse by phone to the local child protection agency. Now, laws regarding child abuse reporting discovered by a professional during the suspected alcohol or drug treatment can differ from state to state. Now, federal law supersedes state law, and it prohibits disclosure without a court order except in instances in which the report can be made anonymously or without identifying the abuser as a patient in an alcohol or a drug treatment facility. Question number 4. Which patient meets criteria for involuntary hospitalization for psychiatric treatment? The patient who A. is not compliant with the treatment regimen, B. fraudulently files for bankruptcy, C. sold and distributed illegal drugs, or D. threatens to harm self and others. And if you're ready, the correct answer is D, threatens to harm self and others. Involuntary hospitalization protects patients who are dangerous to themselves or others. And these are going to be the patients who cannot care for their own basic needs. Involuntary commitment also protects other individuals in society. And the behaviors described in other options are not sufficient enough to require involuntary hospitalization. Question number 5. A voluntarily hospitalized patient tells the PMHNP, "Get me the forms for discharge. I want to leave now." Select the PMHNP's best response. A. I will get the forms for you right now and bring them to your room. B. Since you signed your consent for treatment, you may leave if you desire. C. I will get them for you, but let's talk about your decision to leave treatment. D. I cannot give those forms to you at this time. Pause the video if you have to, and the correct answer is C. I will get them for you, but let's talk about your decision to leave treatment. A voluntarily admitted patient has a right to demand and obtain release, especially in most states. However, as a patient advocate, you're being the nurse practitioner, you are responsible for weighing factors related to the patient's wishes and their best interest. So now, by asking for information, the nurse practitioner here is able to help the patient reconsider that decision. And facilitating a discharge without a consent is not in the patient's best interest before exploring the reasons for the request. Question number 6. A family member of a patient with delusions of persecution asked the PMHNP, "Are there any circumstances under which the treatment team is justified in violating a patient's right to confidentiality?" The PMHNP should reply that confidentiality may be breached A. Under no circumstances, B. At the discretion of the provider, C. When questions are asked by law enforcement, D. If the patient threatens the life of another person. And if you're ready, the correct answer is D. If the patient threatens the life of another person. Now, the duty to warn a person whose life has been threatened by a psychiatric patient, it overrides the patient's right to confidentiality. The right to confidentiality is not suspended at the discretion of the provider or for legal investigation. All right, question number 7. A patient diagnosed with schizophrenia believes a local priest stirred evil spirits. The patient threatens to bomb a local church. The PMHNP notifies the priest. Select the answer with the correct rationale. The PMHNP A. Released information without proper authorization. B. Demonstrated the duty to warn and protect. C. Violated the patient's confidentiality. Or D, avoided charges of malpractice. And if you're ready, the correct answer is B, demonstrated the duty to warn and protect. So, as a healthcare provider, it is your responsibility to warn and notify the intended victim after a threat has been made. And informing this potential victim, in this case is the priest or the church, and is a legal responsibility of the healthcare professional, and it's not in violation of patient confidentiality. Thank you so much for watching. I'll see you in the next video.